Hi, my name is Michelle Mountain, and I'm one of the registered dietitians in the Bariatric Clinic at Humber River Hospital. It's my pleasure to guide you through this online class. In this module, you will learn about lifestyle practices that you can start to work on in preparation for bariatric surgery. These habits and behaviors will help you develop skills that promote successful weight loss and long-term weight management. First important thing to implement is regular meals and snacks. A regular eating pattern is important both before and after bariatric surgery to make sure you are properly nourished and meeting your nutritional needs. Our patients often report improvements in their food choices, portions, cravings, and energy levels when they start eating regular meals and snacks. Remember that after bariatric surgery, you will be eating less and have an altered digestive system. Therefore, it is so important to make sure you are eating regular meals and choosing the healthiest choices. The goal is to have 3 meals a day with 2 to 3 planned snacks. Space your meals 4 to 5 hours apart, and snacks should be 2 to 2.5 hours after meals. Try your best to eat within 90 minutes of waking, and if you struggle with having a regular meal routine, set an alarm to remind yourself to eat. And remember that a meal routine can be adapted to any work schedule. Next is choosing balanced meals. After bariatric surgery, you are at increased risk for nutritional deficiencies due to your altered digestive system. Therefore, your food choices need to be high in nutrients. The best way to do this is by having well-balanced meals. It is important to divide your plate into 3 sections. You can even purchase a divided plate to help you with this. Fill half of your plate with vegetables. Vegetables are low in calories, but very high in vitamins, minerals, and can be quite filling and a good source of fiber. The vegetables can be cooked, raw, fresh, or frozen. Always have a lean quality protein choice with your meals, such as chicken, fish, meat, eggs, yogurt, cottage cheese, legumes, and cheese. Balance the other quarter of your plate with grains, such as quinoa, brown rice, pasta, or whole grain bread, or with a starchy vegetable, such as squash, sweet potato, or corn. Remember that you should be aiming for 2 to 3 planned snacks that include a protein and carbohydrate choice. Patients often tell us that before attending our information session at the bariatric clinic, their plate looks quite different than this. If this is the case, spend some time balancing your meals. Here's what a typical day of eating should look like. The next important step when preparing for surgery is meal planning. Break down the task of meal planning into 4 simple steps. Plan your meals, purchase your meals, prepare your meals, and pack your meals. Using the 4 P's for meal planning both before and after bariatric surgery can help you make healthy eating easier. Meal planning should be something that you were learning and practicing both before and after surgery. Patients often tell us that they make better food and fluid choices when they are planning their meals and snacks. Planning your meals and snacks helps you make healthier food choices, save time grocery shopping, gets meals on the table faster and with less stress, reduces food waste by only buying what you need and will use, and planning is a simple step that can make it possible to eat healthy, save money, and cook more often. Spend time coming up with a plan of what you are going to eat for breakfast, lunch, dinner, and snacks. Purchasing skills help you decide which foods to buy based on nutritional value. Preparing meals at home will lead to less calories, sugar, fat, and sodium. As well, you will likely save money. We recommend that you limit eating out to no more than once a week after bariatric surgery. Learning easy cooking methods can be a very beneficial skill to help with getting meals on the table. If you want to learn more about meal planning, please refer to our module on meal planning. And remember that healthy eating is more than the foods you eat. It is important to be mindful of your eating habits, enjoy the food you're eating, eat meals with others, use food labels to help guide healthy choices, and limit foods that are high in sodium, sugar, or saturated fats. As well, it's important to be aware of food marketing. Next, it's important to use self-monitoring tools. One of the key principles of behavior modification in chronic disease management is self-monitoring. In obesity management, important self-monitoring tools include a food journal, an activity log, regular weighing, and in many cases, a mood journal. One of the most important self-monitoring tools in weight management is a food journal. It's very important to track your food intake both before and after bariatric surgery. Tracking your food intake can lead to better long-term weight management. By recording what you are eating and drinking throughout the day, people become more mindful of their eating habits. A food journal can help you explore not only what you are eating, but why you are eating. When keeping a food journal, make sure you are recording everything that you have eaten or drank throughout the day. Be sure to include when, how much, and why you are eating or drinking. Look for trends in your eating behaviors and habits. Keeping a food journal is also important information that can help your bariatric team guide you in making decisions about your eating habits before and after surgery. Keeping a food journal after surgery is very helpful for tracking your protein intake. You can use paper and pen, or you can use an app to track your food intake. A very popular app that our patients use is MyFitnessPal or Bariatric. It is also important to purchase food scale and measuring cups so that you are weighing and measuring everything you are eating. Regularly weighing yourself is an important self-monitoring tool. It can serve as a reminder to one's eating and physical activity habits. However, we do recommend that you only weigh yourself weekly, as it is not beneficial to be weighing yourself daily. An exercise log is another important self-monitoring tool. Tracking the number of minutes engaged and the type and level of exertion of physical activity should be recorded. A lot of people like to use pedometers or other fitness apps to track their physical activity. Next important step is engaging in movement. Find a physical activity that is enjoyable for you and you will return to day after day. Movement is so beneficial for your physical and mental well-being. The purpose of movement is not to lose weight, but to gain health. The recommendation is to aim for 150 minutes of physical activity per week. You can break the exercise up into 10-minute intervals, and always consult with your doctor before starting an exercise program. Our patients have started a variety of different exercises before and after bariatric surgery. Those include things such as yoga, walking, Zumba classes, aqua fitness, running, cross-country skiing. Another important step is getting adequate sleep. Sleep is a critical aspect of health. The National Sleep Foundation recommends between 7 to 9 hours of sleep per night. If you are struggling with your sleep, please speak to your family doctor and discuss options. Another very important aspect is seeking social connection and support. Having a good support system from family, friends, and coworkers is essential for the best outcomes after bariatric surgery. Remember that after bariatric surgery, relationships may go through changes. Prior to bariatric surgery, work on strengthening your relationships with others. We have a very strong social work team that can help you with this in our bariatric clinic. As well, we offer a monthly support group the last Wednesday of every month that you are able to attend if you are looking for different types of social support. As you are preparing for surgery and developing healthy lifestyle changes, it's also important to change behaviors that may have a negative impact after bariatric surgery. One of these changes is no smoking. After bariatric surgery, don't smoke tobacco, chew tobacco, smoke e-cigarettes, vape with nicotine, or smoke medical marijuana. Smoking increases risks of complications during surgery. It slows healing and can lead to wound infection due to reduced oxygen levels in the body. As well, smoking can lead to heartburn, stomach ulcers, and decreases the body's ability to absorb nutrients. Plan for no NSAIDs after bariatric surgery. So that includes no Advil or Aleve, also known as naproxen or ibuprofen. NSAIDs can lead to ulcers or stomach irritation. NSAIDs are especially linked to marginal ulcers. Work with your doctor to find alternatives if you are taking NSAIDs. If you do have bariatric surgery, have your doctor and pharmacist place an alert on your file so that it is known that you are unable to take NSAIDs. Plan for no alcohol for at least 1 year after bariatric surgery. Very small amounts of alcohol can cause intoxication after bariatric surgery. This is because alcohol moves through your altered digestive system very quickly. Alcohol can also irritate the lining of the stomach. Currently, there are no safe limit guidelines for alcohol or recreational drugs such as marijuana after bariatric surgery. The recommendation is to plan for limited or no alcohol or recreational use after bariatric surgery. Recreational marijuana is discouraged due to potential effects on hunger and satiety. Plan for no carbonation. Carbonated beverages can cause gas and bloating and discomfort. As well, carbonated beverages provide very little nutritional value. If you are consuming carbonated beverages, start decreasing and then eliminating your carbonated beverages in preparation for bariatric surgery. Delay pregnancy for 2 years after surgery. Your body needs time to heal and adjust to life changes that surgery brings. Also, nutritional deficiencies can cause birth defects and may cause a low birth weight. If you are taking oral birth control, we recommend that this is not taken after bariatric surgery, as it may not be well absorbed. Talk to your doctor about alternatives or consult with our bariatric nurses. So just to review, these are some lifestyle practices that you can start to work on in preparation for bariatric surgery. Remember that these habits and behaviors will help you develop skills that promote successful weight loss and long-term weight management.